pleasure to have this opportunity to share with you the delightfully controversial vitamin D. My plan for this next hour is to really give you a broad overview about the health benefits of vitamin D. But before I do, just to let you know that I have been a consultant and speaker over the past 3 years for Quest and Vital Choice, Ontometrics, Abbott, and Biogena. Now, I knew that I had a real issue here because I have a broad audience with varied experience. And so I needed to seek or hire counsel. And I went to a physician that I think you all know and recognize for his expertise. And I asked him to give me some advice. And this is what he said. That's what he said. And so what am I going to tell you about vitamin D that you don't already know about? And it turns out that the Institute of Medicine in 2010 came out with its recommendations. Before 2010, believe it or not, the RDA for vitamin D was 200 international units a day. And they recognized, no, it should be at least 600 units a day for most children and adults. Also, they recognized that vitamin D is not as toxic as we once thought, and that they said easily for adults to take 4,000 units of vitamin D a day would be perfectly fine. Now, I'm constantly asked about this. What do I think about it from press? And I have one word for this, wow. Because there's never been a nutrient that's been tripled overnight. The real question is, did they get it right? And so in 2011, the Endocrine Society came out with its recommendations. And I chaired that committee, and all the members on this committee are experts in the field of vitamin D. And so the objective was clear to have evaluate, treat, and prevent vitamin D deficiency for care of patients. The Institute of Medicine's goal was different. It was not intended for physicians. It was up to professional associations to make these recommendations. And they used a population model, not a medical model. So it's not a surprise that there are differences. We recommend the Endocrine Society for infants 0 to 1 year of age, 400 to 1,000 units a day. For children, 600 to 1,000 units a day. And I think that teenagers should be treated like adults, 1,500 to 2,000 units a day. And if you're obese, you need 2 to 3 times more vitamin D. Now, I also get support from the Sun, much to the dismay of the dermatology community. And you can get more information about vitamin D from this website, drholick.com. Now, I have been talking about vitamin D for more than 50 years. People could not think of a more boring subject than vitamin D. Found in cod liver oil, prevents rickets in children. We're not seeing rickets any longer. We're not thinking about vitamin D. So what is she thinking about? Well, who is at risk? Hopefully convince you that everyone is. Worried about global warming? No. What's the big deal about vitamin D deficiency? Rickets is really the tip of the iceberg, a painful bone disease that I'll talk more about in a little bit, osteomalacia, diabetes, multiple sclerosis, rheumatoid arthritis, infectious diseases, hypertension have all been associated with vitamin D deficiency. Now, I thought I'd bring you a case that you may not typically see in your own practice. Here's a 7-month-old female, muscle weakness, seizures, calcium half normal. And it got a lot of publicity in Boston because it's the first lowland gorilla born in captivity at the Franklin Zoo in Boston. And this was a problem. The pediatrician saw the infant. It gave 400 units of vitamin D, didn't do any good, concluded that the infant had some rare genetic disorder. And so the infant complaining, bones are aching, dad's upset. So you ever wonder what he was trying to say? That's what he was trying to say. Indeed, mom suggested they call me. I got to see the infant. Infant has classic widened epiphyseal plates, classic for rickets. How do you treat? Aggressively. I gave the infant 5,000 units of vitamin D a day, and the infant's feeling great. In fact, I was a guest of her first birthday as guest of honor. But what's the message? Mommy, will my growth be stunted because of her in utero in her first few weeks of life of vitamin D deficiency? She had significant growth retardation. We estimate in the United States and really worldwide, probably more than 50% of infants are born deficient or insufficient. 1889 in Boston, rickets was common. Is this a problem today with all of modern medicine? You better believe it. We still see on average a dozen cases a year at our hospital, mainly children of color, right? Why? Because it's been recommended that human breast milk is the sole source of nutrition for infants. It's a great nutritional source, but it contains essentially no vitamin D. So if you give your infant human breast milk as the sole source of nutrition, that infant will be vitamin D deficient for that period of time. I'm not sure what Brittany's thinking about, but we asked the question, what if pregnant women are following their doctor's advice and taking a prenatal vitamin, right? Are they going to be deficient? So we did a study, 40 mother-infant pairs. They were taking on average 600 units of vitamin D a day, the amount recommended by the Institute of Medicine for all adults, including pregnant and lactating women. We showed 76% of moms, 81% of newborns were vitamin D deficient. Why should you care? Because preeclampsia, one of the most serious complications of pregnancy, we went on to show with Lisa Bodner, higher risk of preeclampsia if you are vitamin D deficient. In fact, there's a very nice study that confirmed that observation. If you keep your blood levels in the range of 40 to 50 nanograms per ml, you reduce risk of preeclampsia substantially. And it's important to do it throughout pregnancy. Also, cesarean sectioning, of course, is becoming much more common. Birthing needs good muscle strength, and vitamin D plays a critical role. So we did a study and asked the question in over 200 women at our hospital whether they required a C-section and related it to their vitamin D status. Probability for a C-section was reduced by 400% if they simply were vitamin D sufficient at the time they were giving birth. Maternal vitamin D insufficiency in early pregnancy is associated with preterm births. And so it's important to have pregnant women vitamin D sufficient. 60% lower preterm births, just if you maintain an adequate blood level of 25-hydroxy vitamin D. And that range is around 40 nanograms per ml. Mom, thanks for taking your vitamin D. Right? I'm not sure what Christina's thinking about, but for lactating women, right, they need certainly at least 2,000 units a day. Pregnant women certainly need at least 2,000 units a day, and on top of their prenatal vitamin, right? How much a lactating mother needs to put enough vitamin D in her milk to satisfy her infant's requirement? Bruce Hollis and Carol Wagner showed up to 6,400 units a day, right? Pediatricians have been concerned about toxicity of vitamin D, but we now recognize, and even the American Academy of Pediatrics recognizes, infants need it from birth, especially breastfed infants. The recommendation, 400 units of vitamin D a day. The problem is vitamin D really rare in foods you would think with a healthy diet? So in the United States, we looked at the National Health Survey data, and even 200, 400, or 600 units a day, no child or adult in the United States is able to get enough vitamin D from dietary sources. Dairy certainly contains 100 units in a serving. If you were to follow the Institute of Medicine's report, you would have to drink 6 glasses of milk a day. Now, why is he carrying this mushroom out in the sun? Because it turns out sun-dried mushrooms, mushrooms exposed to ultraviolet radiation, is a superb source of vitamin D because they have a huge capacity to make vitamin D, and they make vitamin D2. We know cod liver oil, the children used to line up in the 40s and 50s, right? Because it tasted so good. We don't do this anymore, right? It comes in tablet, emulsion, right? But I'm constantly interviewed by the press saying, well, you know, don't listen to this guy Holick about sun exposure. No, you have to eat more fish. Well, how much do you have to eat? It's not a pretty sight. Indeed, I go sail fishing with my son, a catch-release program in Guatemala. These sailfish are beautiful fish. They have none. Rooster fish, they don't have any. It's only oily fish, salmon, mackerel, herring. And you need to have wild caught because farm salmon, we showed, has hardly any vitamin D. You would have to eat salmon every day. There's only 500 to 1,000 units in a serving in order to get enough vitamin D. So you can see the problem. You can't get enough from your diet, right? So what about sun exposure? Casual or not so casual sun exposure is our major source. In fact, feeling great, making vitamin D in your skin. But what about in the wintertime? In the summertime, the sun rays are coming directly through the ozone layer and you're making vitamin D. But what about in the winter? Well, you wear more clothing, right? But also the sun is coming in at a more oblique angle. and it's being absorbed by the ozone layer. And so the question is, can you make any at all? And so we did a study, and we showed that if you put some test tubes up on the roof in the spring, summer, and fall, in Boston, you make vitamin D. In the winter, you can't not make any at all. Well, the obvious next question is, my colleagues call me up and they say, we need evidence-based medicine. And so I went to my colleagues and my students. I said, I need somebody to prove this. And I finally got a volunteer, right? Can you make any in the winter in Boston? And the answer is no, right? Indeed, believe it or not, if you live above and below Atlanta, Georgia, you can't essentially make any vitamin D. But if you go down to Florida, like my daughter did for spring break, you can make it year round. So again, that latitude is at about 32 degrees north and south of the equator. You basically cannot make any significant vitamin D from about November until March, April. And if you live further north or in Europe, they can't make vitamin D for almost 6 months of the year. It's also suggested go out in the early morning, late afternoon, go jogging, make your vitamin D less damaging to your skin. I'll tell you what, it's good for romance, but you make no vitamin D. You only make it even at the equator from about 9 or 10 until about 3 or 4 o'clock in the afternoon. So late afternoon sunlight will not do it. Now, Star Wars continues to have these magnificent characters, and my favorite is Jabba the Hutt. But I always wondered, what was he trying to say? So I finally got a translator. That's what he was trying to say. Obesity associated with vitamin D deficiency. Indeed, even Barney is aware. The higher your BMI, lower is your vitamin D status, 25-hydroxy vitamin D. We did a study to prove the point. We took healthy adults and obese adults, put them on our tanning bed, or gave them an oral dose of vitamin D. And we showed that they could only raise their blood level by about 45% compared to controls. Is it really there? Evidence-based medicine. Went to our bariatric surgeon, we got some fat, and we showed there's huge amounts of vitamin D in the body fat. So the next question is, what do you do? Well, the Endocrine Society recommends that for obese people, BMI greater than 30, you need to take 2 to 3 times more vitamin D to satisfy that requirement. What about gastric bypass surgery? You lose all of this fat with all the vitamin D. Are you going to become toxic? So we did a study, and we showed that losing even 50 kilograms of fat over a period of about a year, there was no change in 25-hydroxy vitamin D levels. So you don't have to be concerned. But we know gastric bypass patients have often a difficult time in absorbing vitamin D. So I often will have patients on 50,000 units of vitamin D 2 or 3 times a week sometimes in order to be able to maintain a healthy blood level. What about Pele here and his girlfriend? Skin pigment is a perfect sunscreen. It will absorb the vitamin D producing rays. And so he would need to be outside 5 to 10 times longer to make the same amount of vitamin D as his girlfriend for less time. Now, the other issue is that what if you're severely vitamin D deficient? And we find this to be true, certainly, people of color, partly because of their decreased efficiency of their skin in making vitamin D. And so if you have a blood level, for example, of 10 nanograms per ml or 25 nanomoles per liter, right, should you be giving them a lot more vitamin D to fill up the tank? And it turns out you don't have to do that. You can give the same treatment, whether it's a very, very low blood level or a medium low blood level. And the reason is that you have 4 different 25-hydroxylases in your liver. And so if you take a tiny amount of vitamin D, you rapidly metabolize it, and the blood level will go up to about 15 nanograms per ml. And then after that, you need 100 units to raise it by 1. So how do you define deficiency? As you probably already heard over and over again, you want to measure 25-hydroxy vitamin D. You never want to measure the active form of vitamin D. It tells you nothing about vitamin D status. Vitamin D deficient patients are often have normal or elevated level of 125 dihydroxy vitamin D. Why? It circulates at 1,000 times less concentration than 25-hydroxy D. And when you become D deficient, you decrease ionized calcium. PTH goes up, and it tells the kidneys to make more 125 dihydroxy vitamin D. And that's why often it's normal or elevated when your patient's 25-hydroxy vitamin D is very low. What about normal range? Well, it turns out docs all don't have the time to look at numbers. Is it H, is it N, or is it L? And so typically at the end of the summer, I'll get phone calls from my colleagues saying that their patient coming back from a summer holiday, that their blood level is 110 nanograms per ml. Are they toxic? No, I don't think so. I see lifeguards in my clinic, not so much the Baywatch babes, right? I don't think that they worry about toxicity. You don't have to worry about toxicity based on the Endocrine Society practice guidelines unless you're above 150 nanograms per ml. And so how do you know if you're low? Well, we did a study and asked the question, do you really need to be at least 30 nanograms per ml, right? A lot of controversy about this. So we did a study and we showed in postmenopausal women throughout the entire United States and looking at their PTH levels, they begin to plateau at around 30 nanograms per ml. If you look at people with secondary hyperparathyroidism at 20 compared to 30, you have a marked decreased risk. Is vitamin D deficiency a health issue, right? Globally, we recognize now 40% of children and adults are deficient, 60% deficient or insufficient. How do you know what the preferred range should be? The Endocrine Society recommends 40 to 60 nanograms per ml. So 20 to 30 is considered to be insufficient, and above 30 is considered to be sufficient based on Endocrine Society guidelines. So what about vitamin D deficiency? Its consequence on bone health, right? It will increase PTH and will cause bone loss. Subclinical vitamin D deficiency will precipitate and exacerbate bone loss. What's happening is you're increasing osteoclast number and you're starting to chew up mineral and matrix, decreasing bone mineral density. Bone loss often is a silent disease, right? But osteomalacia is not, right? So typically, curiously, your aches and pains in your bones and muscles always occur in the winter. I wonder why. Symptoms: generalized bone pain, isolated bone pain, muscle aches and pains. Nouveau diagnosis: fibromyalgia, chronic fatigue syndrome. Most of these patients I see in my clinic are vitamin D deficient. I correct their vitamin D deficiency. Sometimes it takes weeks to months. They have dramatic improvement in their quality of life. This is a major health issue. Mayo Clinic proceedings in 150 children and adults presenting with aches and pains in their bones and muscles, 93% were vitamin D deficient. He's constantly complaining to his dog about aches and pains in his bones and muscles. The dog told him, stupid, vitamin D deficient, right? We want you to be at least 30 nanograms per ml based on Endocrine Society practice guidelines. Maximum bone health, maximum muscle function, less likely to fall, less likely to fracture. How do you treat vitamin D deficiency? Well, when you go to your gas station, your tank is on empty, do you just get a liter or a gallon of gas? No. And so you want to fill it up. And so what we do here in my clinic, because the pharmaceutical form of vitamin D is 50,000 units of vitamin D as a form of vitamin D2, once a week for 8 weeks. Now, why vitamin D2? It predates the FDA. And so as a result, no one ever got approval for vitamin D3. 50,000 unit vitamin D3 is available as a supplement, but not as a pharmaceutical. That's equivalent to about 6,500 units a day, right? And then after 8 weeks, you fill up the tank, right? What do? And so often they put these patients back on 1,000 units a day. They'll come back to my clinic 6 months later, vitamin D deficient, right? So what I do is I put them on 50,000 units now once every 2 weeks forever. It's equivalent to about 3,300 units of vitamin D a day. Now you may argue, well, we've been taught that vitamin D is toxic. So what is going to happen if you take this amount day after day, year after year? Is it going to build up in your body fat and cause toxicity? Well, Einstein worried about this as well. And so we did a study over 6 years, and we showed that on this regimen, their levels are perfectly in the normal range of 40 to 60 nanograms per ml, and there was no toxicity. We know from our study in Boston in the wintertime, healthy adults taking 1,000 units a day essentially no one was deficient. What about toxicity? Well, certainly vitamin D toxicity can occur, extremely rare, causes hypercalcemia, hyperphosphatemia, suppressed PTH, and of course, kidney stones, soft tissue calcification. Bob Heaney and I showed many years ago, you could take up to 10,000 units of vitamin D a day is perfectly safe. In fact, a study done out of Canada where Canadians take up to 20,000 units a day, right, with the upper range being 100, right? No one was above 100, taking up to 20,000 units of vitamin D a day. And we're talking about over 22,000 observations. But what about infants and children? And so Catherine Gordon at Children's Hospital showed very nicely, you can treat infants and toddlers with 50,000 units once a week for 6 weeks, or 2,000 units a day for 6 weeks. What about pregnant women? Very nice study by Hollis and Wagner showed you can give pregnant women up to 4,000 units a day, get that blood level in the range of 40 to 60 nanograms per ml, right? Reduce risk of preeclampsia and requiring a cesarean section, premature birth. No effect on serum calcium, no effect on urinary calcium. There was no toxicity. But you can become toxic. This poor gentleman went on the internet back in the early 90s and bought this product and took 2 teaspoons a day, thinking he was taking 2,000 units a day. He called me up and needed my help. And so I told him to send the material up because it didn't make any sense to me. He should become toxic on this amount. And we did an analysis. The company forgot to dilute it. He was taking 2 teaspoons of pure crystalline vitamin D, 1 million units a day. This will cause toxicity. In fact, he called me back, and his calcium initially was 15, 25-hydroxy-D 500. I told him, low calcium diet, no vitamin D, wear sunscreen all the time. And his calcium quickly came down after hydration, and his 25-hydroxy-D gradually came down, but he had no sequelae from this experience. It is difficult to become vitamin D toxic. So why should you care about all this, right? We know vitamin D is made. It goes to your liver, converted to 25-hydroxy vitamin D, and then it goes to your kidneys where it gets activated to 125-dihydroxy vitamin D. And we know 125-dihydroxy vitamin D's function is to increase intestinal calcium absorption, remove calcium from the bones when you're not getting enough dietary calcium, and regulating calcium excretion in the kidneys. All makes sense. However, we now recognize that essentially every tissue and cell in your body has a vitamin D receptor. Why would they be there if they weren't having a biologic function? Earliest observation was made by Dr. Suda, 1979. He took leukemic cells that had a vitamin D receptor, incubated them with active vitamin D, and showed that they became normal. That introduced the concept that maybe vitamin D is somehow playing a role in malignancy. And so it turns out that there's a lot of evidence linking vitamin D deficiency and sunlight deficiency with increased risk for deadly cancers. A very nice study by the Garland brothers back in the 90s showed that if you increase your vitamin D intake to at least 1,000 units a day, significantly reduce risk of colorectal cancer. Nice study out of Harvard showed, Nurses' Health Study, that nurses that had the highest blood levels, on average around 48 nanograms per ml, and to get there, you would need to be on about 3,000 to 5,000 units a day for a normal weight woman, right? Reduced risk of breast cancer by almost 50%. Also, a study done out of Nebraska where they took women that had vitamin D sufficiency, 25-hydroxy vitamin D of 30. This is Bob Heaney's group. And he gave them an additional 1,200 milligrams of calcium and 1,100 units of vitamin D, and followed them for 4 years and showed a 60% reduced risk of them developing cancer. So what's the possible connection? Well, you would think it's pretty obvious, right? Active vitamin D can regulate cancer cell growth. So maybe if you increase your vitamin D intake, you can get your kidneys to make more active vitamin D, which will help prevent malignancy. Problem is, Your kidneys only make 125 dihydroxy vitamin D for one purpose: to regulate calcium phosphate metabolism and maintenance of good bone health. So no matter how much vitamin D you take, how much sun exposure you have, you will not increase your blood levels of 125 dihydroxy vitamin D. That was a real conundrum, because how is it that all these receptors exist, right? But yet 125D is being produced to regulate calcium metabolism. And so we and others, and Gary Schwartz in collaboration, showed that prostate cells have the capacity to activate vitamin D. In fact, many studies by many investigators have now shown that many cells in your body, brain, skin, colon, all have the capacity to activate vitamin D. We now recognize that what's happening is that when you maintain a healthy blood level of 25-hydroxy-D, these cells can convert it to active vitamin D. They regulate gene expression, and then they destroy themselves, right? Because they increase 24-hydroxylase activity. So the 125D is only internally made, acting in an autocrine fashion, will never have an effect on calcium metabolism. It's estimated upwards of 2,000 genes being regulated by your vitamin D status. And so, is there any benefit for COVID pandemic? There's been a lot of information out there on the literature about this, some quite controversial. Well, let's talk about the immune system first, right? What is the effect on the immune system? Inactivated B lymphocytes have no receptor. You activate them and they do. Why? Because 125 dihydroxy vitamin D produced locally in macrophages regulates the production of cytokines in T cells and antibodies in B cells. So vitamin D, through its active form, is regulating both immunoglobulin synthesis and cytokine production. Now, also, we know activated macrophages activate vitamin D. Have you ever wondered why? We now know why. 1849 cod liver oil was effective for TB, right? Vitamin D protects against TB. Why? Adams, Maudlin, and Liu published Science, 2006, a remarkable observation. We know that if you infect the macrophage with any kind of infectious agent, the cell toll-like receptors are turned on. Why? It tells the cell to activate vitamin D. Why? Because active vitamin D goes back into the cell to tell the cell to make defensive proteins, cathalicidin, which specifically kills infectious agents. That's probably why living at higher altitudes or solariums were effective in helping TB patients. We've always known that the flu occurs in the wintertime. And Hope Simpson suggested there's a seasonal stimulus. What might that be? So at the peak flu season is when the blood levels of 25-hydroxy vitamin D are at their lowest. And so a study was done out of Yale. They showed that if you have a blood level of 38 nanograms per ml on average, you reduce risk of upper respiratory tract infections twofold. A very nice study out of Japan showed school children taking 1,200 units of vitamin D a day just during the wintertime reduced risk of influenza A infection by 42%. So is there any evidence that vitamin D can have an effect on your immune system? Well, we asked that question. And so we did a study. We took healthy adults and gave them 2,000 units of vitamin D a day for 3 months. We got their white blood cells before and at the end of the study, and we did whole genome, expression analysis of almost 23,000 genes. All of these blue lines is an individual gene that's underexpressed. All of these orange and red lines are all genes overexpressed. Before, these 291 genes, underexpressed, overexpressed. Just taking 2,000 units of vitamin D a day, all of these genes were turned on and all of these genes were turned off. What were they doing? It turns out that when we looked at these genes and what they do, remarkable. They regulate more than 80 different metabolic processes: DNA repair, apoptosis, oxidative stress, metabolic processes, anti-inflammatory activity. Can you dissociate vitamin D's effect from these other immunologic effects? We wondered about it. So we did a study. And what we did was we looked at PTH levels, which is a measure for calcium metabolism. And we did expression analysis. We gave for 6 months, 600, 4,000, or 10,000 units a day to healthy adults. And as you can see, they're all well matched, and they were all vitamin D deficient or insufficient. And we showed very nicely that if you look at the PTH levels for 600 units a day, placebo versus on 600 units a day, hardly anything. Here you can see the 25-hydroxy vitamin D going up on 4,000 units a day and the PTH levels coming down. And for this group, getting 10,000 units a day, dramatic increase in 25-hydroxy vitamin D, and the PTH levels didn't really decrease much lower than on 4,000 units a day. So what now is the effect on gene expression? And so all of these lines are genes. And so you could see all of these blue are turned red, and all of these red are now becoming more blue. Red, blue, blue, red. We showed 162 genes just on 600 units a day were up and down regulated. On 4,000 units a day, look at all that increased number, 320. But what about on 10,000 units, where it doesn't really have any significant additional effect on PTH? Look at all these lines. We're talking about well over 1,000 genes being regulated by being on 10,000 units a day. Here's an interesting observation that was made in India. A dermatologist called Dr. Marwa, who's my good friend and expert in vitamin D in India, and said that he has a child with ichthyosis and rickets and needed to treat the rickets, and how best to do that. Well, it turned out that the recommendation in India is 60,000 unit sachet, and they give it once a week for 10 weeks. The dermatologist misheard this. So this is the child before, and the dermatologist gave this child 60,000 units a day for 10 days. So they thought, oh my gracious, this infant's going to be toxic. Well, it turns out instead, the dermatologist calls up Dr. Marwa and tells them, oh my gracious, it's been effective in helping the child. So there may be some benefit to vitamin D. Feed your genes right with vitamin D. So what about COVID? Right, we know that innate immunity and adaptive immunity play a critical role in helping to fight this infection and possibly reducing or possibly exacerbating morbidity and mortality. And it turns out that 125 dihydroxy vitamin D plays a critical role in innate immunity on dendrocyte, macrophages, phagocytes, and as well as adaptive immunity, right, on T and B lymphocytes, as I had mentioned just previously. The cytokine storm is a major issue with this viral infection and is a major cause for morbidity and mortality. And it turns out that 125 dihydroxy vitamin D can down-regulate cytokines that are potentially damaging, that can cause cytokine storm. And they improve cytokines to help fight infection. And we also know that this virus is clever, and it gets in through the ACE2 receptor. And it turns out, curiously, that vitamin D through 125 dihydroxy vitamin D plays a role in the angiotensin renin overall system and may play a role in regulating the receptor as well. So there is some suggestion that maybe improvement in vitamin D status could reduce risk for infection. So all of these are really nice theories, but the question really is this really true? What is the evidence? And so we did a study with Quest Diagnostics, who does millions and millions of measurements for 25-hydroxy-D, and we had an opportunity to take a look at 191,000 plus patients that presented that had COVID positivity. So we knew that they were infected, and we asked the question, at the time of infection, what was their 25-hydroxy vitamin D level, or within a year of that? And we showed very nicely that if you're vitamin D deficient, you have a high risk of acquiring this infection. And the higher your 25-hydroxy vitamin D, lower was your risk. In fact, if you got to around 30 nanograms per ml, it reduced it by 54%. And if you continue to increase your 25-hydroxy vitamin D out to about 55 nanograms per ml, you continue to have benefit. So what about African Americans, especially people of color, are at much higher risk of acquiring this infection? And of that 191,000, we looked at zip codes for where people of color were living. And we showed very nicely, compared to African American and Hispanic, the higher their 25-hydroxy vitamin D, that benefit continued. Lower was their risk of acquiring the infection. Living northern, southern, central, or southern latitude didn't make any difference. Higher your 25-hydroxy vitamin D, lower is your risk. And what about age? Big deal. We know that elders are much more prone to higher risk for morbidity and mortality. Made no difference. Higher the 25-hydroxy vitamin D for all age groups, there was a positive benefit, reducing risk. And also we looked at male versus female, no difference. But now the question is, but will vitamin D improve health outcomes? And so we did an additional study with Dr. Magbuli in Tehran. And what we showed was 235 patients that presented with serious infection, 74% serious disease. And we looked at severity, consciousness, hypoxia, C-reactive protein, and lymphocyte count. They all were related to vitamin D status. Higher your vitamin D status, lower was morbidity. And we then looked at deaths, and we only saw deaths over the age of 40 and showed 51.5% reduced risk of deaths just by being vitamin D sufficient. 25-hydroxy D of that magical number above 40 nanograms per ml. So we did get a lot of publicity in Boston. And also the Herald showed very nicely that 100 years ago, that sun exposure and solariums were used to help fight infections. We also know from this very interesting study, looking at latitude and type 1 diabetes risk. And the higher the latitude that you live, higher is your risk for type 2 diabetes. Study done in Finland, infants getting 2,000 units a day, receiving, and followed for 31 years, 88% reduced risk. But the experts came in and they said, you can't give 2,000 units a day to an infant. So they started decreasing the intake of vitamin D. And look at the increased risk of type 1 diabetes in these individuals who had less vitamin D intake during their first year of life. What is the evidence for the beta islet cell? We know they have a vitamin D receptor. 125D will stimulate insulin production. And metabolic syndrome and type 2 diabetes have been associated. National Health Survey showed higher your intake of vitamin D and calcium, adequate calcium intake, lower is your risk. Also, live that magical latitude above 35 degrees for the first 10 years of your life, you have a 100% increased risk of acquiring multiple sclerosis. A study done out of Harvard showed women at the highest intake of vitamin D reduced risk of MS 41%. Iowa study, rheumatoid arthritis, reduced 44%. What about cardiovascular disease? Peripheral vascular disease from the National Health Survey data showed 25-hydroxy D of greater than 30, 80% reduced risk. What is the mechanism? We know where the 200 genes being regulated, controlling atherosclerotic production, blood pressure control, and cardiomyocyte function. Also, Framingham Heart Study showed if you have a blood level of less than 15 nanograms per ml, 50% higher risk of having a heart attack. What are they thinking about? They are at risk. National Health Survey showed that well over 50 million teens at risk and at much higher risk for hypertension, elevated blood sugar, and metabolic syndrome. We did a study with Dr. Dong down in Georgia and showed that when we gave African American teens 2,000 units a day they were severely vitamin D deficient, toxicity of 11. Only those that received 2,000 units a day had significant improvement in arterial wall stiffness, right, the prelude to hypertension. And so, what about living longer? Well, it turns out, a nice study from Germany showed higher your 25-hydroxy vitamin D, lower is your risk by about 25%. Does it predict all-cause mortality, cardiovascular mortality, and even from mortality from congestive heart failure? Also, very nice study done by Cedric Garland showed higher your 25-hydroxy vitamin D, lower risk for morbidity, mortality. But what about the vital study, right? What about the studies showing basically no benefit? I think it's worthwhile reading that study carefully. It turns out that 55.1% of those study participants were vitamin D sufficient at the time they started the study. So not a surprise if you give a little bit more vitamin D, it's going to make any difference. And even Dr. Manson said that even though she saw no benefit in reducing risk for cancer, she did recognize 25% statistically significant decrease in cancer mortality. And she recognizes that cancers take a long time to develop. So taking vitamin D for 4 or 5 years may not be enough to really see the benefit. Vitamin D deficiency is a disease of neglect, right? We need it from birth until death. Amount of evidence linking it to these chronic illnesses, right? Think about disease burden and vitamin D deficiency. Pretty significant. Don't think about a normal level, but a healthy level. You want your level to be in a healthy range. And how much vitamin D do you need? Well, how do you know how much you want? I think our hunter-gatherers are giving us a good insight. These Maasai herders, right, who have perfect skin tone for their environment, right, tiny amount of ultraviolet radiation still penetrating through their skin, designed by Mother Nature. Their blood levels by Lux Walda showed 40 to 50 nanograms per ml, right, that preferred range, right? You would have to take 4,000 to 5,000 units of vitamin D a day to reach that level. Goal, minimum should be 30 nanograms per ml, as recommended by the Endocrine Society practice guidelines. Preferred range 40 to 60 nanograms per ml. And this is shown over and over again, whether it's for preeclampsia or for mortality or for cesarean section, premature births, and even COVID, morbidity and mortality, and acquiring the infection, all related to that level. How much vitamin D do you need? Well, it turns out, like I said, once you're at around 15 to 20 nanograms per ml, so at around 50 nanomoles per liter, which is equivalent to 20 nanograms per ml, you have to take 100 units to raise it by 1 nanogram per ml or 2.5 nanomoles per liter. Most adults are therefore vitamin D deficient or insufficient, right? And if you take 1,000 units a day, you will not become sufficient. And that's why the Endocrine Society recommends 1,500 to 2,000 units a day. What I recommend to all of my patients, minimum should be 2,000 units a day. Children, 1,000 units a day. Conquer vitamin D deficiency. Best source, back in the 30s, they cleverly marketed Bond bread. If you wanted your kids not to be outside every day naked, vitamin D fortified Bond bread was an alternative. I know that young adults wouldn't be D deficient today if they were still doing this. Back in the 1930s, they were fortifying beer with vitamin D. FDA did not take kindly to this, and so they banned the fortification of beer because they didn't want to have a nutritional benefit for drinking beer in 1937. But I went on eBay and I bought a can. Schlitz Sunshine Vitamin D. Look, Johnny, a spot of sunshine and playing it. 1953, New Yorker. Right? Always have appreciated the beneficial effect of the sun. So I'm a proponent of sensible sun exposure. How do you get the message out to the public? I published a book. I did not want to be controversial. And so I said, I do not advocate tanning. Those that wish to do should do it responsibly. And yes, excessive exposure to sunlight increases risk for non-melanoma skin cancer. But everybody worries about melanoma. Well, it turns out Did you know that most melanomas occur on the least sun-exposed areas? And occupational sun exposure decreases that risk. In fact, there are the data. Lifetime sun exposure associated with a lower risk of malignant melanoma. Ancestors' view of the sun a little bit different than the dermatologist's view. They always recommend sun protection. SPF of 30, properly applied, reduces your ability to make vitamin D in your skin by about 97 to 98%. Have you ever been on rounds with an unenlightened dermatologist? I like the kinder, gentler view on life, and Schultz epitomizes this. And here in the penis character, are you sitting in the sun? I hope so. A little sun is good, as long as we don't overdo it. Perhaps 10 minutes a day. This time of the year is about right. That's what we need, moderation in our recommendation, right? This is what's happened to our sun. It's been demonized for more than 50 years, right? Stop measures in Australia, 40% are now deficient. Who's that? It's an Australian dermatologist on vacation. And guess what? They're vitamin D deficient, right? 87% at the end of the summer. Vitamin D deficiency is associated with schizophrenia, depression, dementia, and Alzheimer's disease. We have a vitamin D receptor in our brain. Our brain can activate vitamin D. And we also know vitamin D, at least in animal studies, can increase serotonin levels, making you feel better. And there's a lot of different consequences for vitamin D deficiency, thinking about central nervous system disorders. You can get it from your diet. That's what we've been taught. I've hopefully convinced you cannot get it from your diet. So what do I do? What do I recommend? Right? The best source, World Health Organization even says, getting some sun is good for making vitamin D. But the problem is time of day, season, latitude, degree of skin pigmentation. So how much and how long do you stay outside? Well, there's only one thing to do. We developed an app. It's free on your Android as well as on your iPhone. It'll tell you anywhere on this planet when you can make vitamin D, how much vitamin D you make, and it warns you to get out of the sun so you don't get a sunburn. What do? Sun protection on my face and on my arms. And I, like all my family members, about 6,000 units of vitamin D a day. And my blood level in range of about 70 nanograms per ml. Vitamin D deficiency is probably the most common medical condition worldwide. If any one of these chronic illnesses, especially now with COVID-19, turn out to be associated with vitamin D deficiency, there's no downside to increasing your risk of taking it, right? We don't need to be a genius to know this. We need sensible sun and supplement recommendations. This is not a hypothesis. So should you be screening everybody? And the answer is no, right? Taking an adequate amount of vitamin D, getting some sensible sun exposure will not become toxic, right? But however, if you have malabsorption problems, sarcoidosis, hypersensitivity to vitamin D, then you need to be followed carefully. I wrote a book called The Vitamin D Solution. Vitamin D can improve your health. I want to thank Biogena for supporting this program. And as you're well aware, that they have several vitamin D formulations, including liquid form and a vegan formulation that's quite nice and very effective. And they also are very much involved in micronutrient, providing the perfect micronutrients, and they have a micronutrient coach. And you can go to this website, micronutrientscoach.com, to actually get the book as yours for free. And so I want to thank you very much for your kind attention and happy to answer questions.
Thank you, Dr. Holick. Just a reminder, you can ask your questions in the chat box, and we will get to as many as time allows. We have some questions that came in early on. Our first question here is, bear with me 1 second. Is it better to take cod liver oil?
So there's nothing wrong with cod liver oil. And obviously, some people haven't acquired a taste for it. But it depends upon the purity of your cod liver oil, because there's a lot of PCBs have been found in some cod liver oil preparations. But the more important issue is you can only take a certain amount of cod liver oil because you have to worry about the vitamin A content. which can cause birth defects and also can cause bone loss. And so you can't take too much cod liver oil to get enough vitamin D in the range of 2,000 units a day without getting too much vitamin A.
Someone was asking, can you give us the resource again for the micronutrient site?
Sure. They're going to be getting, of course, the PDF. And so
yes,
there it is right at the bottom.
Okay, great. Our next question here is regarding, can vitamin D be administered together with vitamin K2 and B5 for better absorption?
Yeah, excellent question. So first we'll begin. So do you need to take vitamin D on an empty stomach or full stomach? Turns out it doesn't make any difference. Do you need to take it with a meal or without a meal? Doesn't make any difference. Do you need to take it with fat or without fat? Doesn't matter. Right? We did all those studies. We showed that vitamin D put in orange juice, for example, which is available here in the United States, is perfectly bioavailable. And skim milk, which has no fat, we showed skim milk, vitamin D is bioavailable, same as in whole milk. And so it really doesn't make any difference. And so when thinking about vitamin D, you can take it daily or even weekly. It doesn't really make any difference. So what about vitamin K2? There's been a lot of interest about this. In my opinion, it will not have any influence on vitamin D absorption. And in my opinion, it has no essential interaction with vitamin D and its biologic function. No reason not to take it with it. It won't hurt you to do it. It will not have any influence on its bioavailability, but you don't need to take vitamin K2 to absorb vitamin D, and in my opinion, for vitamin D to function on calcium and bone metabolism.
Thank you. Our next question, are you aware of any studies showing vitamin D's role in male and female fertility?
There actually are quite a few studies demonstrating improvement in fertility, especially in males. And we think that women that are vitamin D sufficient also have improvement in fertility.
Thank you. Our next question, someone's wondering, is it the lack of sunlight or the diet that make breast milk deficient?
Right. So this is really, believe it or not, it's a simple answer, which is our hunter-gatherers outside every day, just like the Maasai herders that I showed you about, right? Their blood levels likely were in the range of 40 to 60 nanograms per ml. They were probably making on average 4,000 to 6,000 units of vitamin D a day, right? And Hollis and Wagner showed if you give a lactating woman 6,000 units of vitamin D a day, she finally puts enough vitamin D in her milk to satisfy her infant's requirement. So it doesn't matter whether it's sunlight or supplement. It's that you need to take enough vitamin D to have a constant input into the milk. You have to maintain a blood level of vitamin D, not just 25 hydroxy vitamin D, but vitamin D for it to get into the breast milk to satisfy the infant's requirement.
Thank you. We have time for about 2 more questions. Our next question is air pollution contributing to decreased vitamin D absorption?
Yeah, no question, because we had published a paper on this many years ago. We showed in California, in Los Angeles, right there at a latitude of about 34 degrees, you would think they'd make lots of vitamin D. A lot of them are vitamin D deficient in LA, and the reason is that they live in a bowl and they're covered in air pollution. And we showed that nitric oxide, ozone in particular, particulates, all absorb the vitamin D producing rays and markedly reduce the amount of vitamin D you produce. And by the way, the app, dminder.info, which uses the satellite imaging to know how much UV is penetrating to the Earth's surface, takes that into account.
Thank you. And we have a question. What is the difference between vitamin D and vitamin D3?
Yeah. So vitamin D2, like I said, comes from yeast and plants. Vitamin D3 is what you make in your skin. There's been a lot of controversy about vitamin D2 being much less biologically active. And it's true. If you give like 100,000 units, you will raise the blood level of 25-hydroxyvitamin D to a little bit lesser extent than giving vitamin D3. But they basically are recognized by the liver the same. We showed that they're recognized, the 25-hydroxy forms, exactly by the kidneys. And we've shown that physiologic doses of vitamin D2 and vitamin D3 are equally effective. And so in India, for example, they fortify their food, cooking oil and milk with vitamin D2 because vegans would prefer vitamin D2 rather than vitamin D3 because vitamin D3, for the most part, comes from animal sources. And as you're aware from the information I provided about Biogena, they do have a vegan vitamin D3 that's coming from lichen.